for our exam. But for this, the palpation of the liver. Palpation of the liver, okay, the same thing. You need to percuss first before palpating. As I said, again, there's two ways. One, you percuss and palpate, or you just start palpating. Okay, because some teachers they tell you without percussion, palpate without percussion. But usually here in third year, usually you percuss first, then you palpate. So if you're going to percuss and palpate, you just percuss the which border, upper border or lower border? Just the lower border. So same thing, mid clavicular line, below the umbilicus. Okay, so now you're going to focus. This is the point where you're going to palpate. So liver palpation, no more monkey hand. No more monkey hand. It's straight like this. Okay, like this. So your hands will be like this, all straight. Okay, okay. So this hand goes directly on the abdomen here. Okay, okay. Flat. Your hand must be on the abdomen. Full. Next, fixate the liver. Go here, rib cage, press. You are fixating the liver. Okay, fixate. But now, inspire, inspire, skin fall downwards, expire, inspire. You see? Again, again, look carefully. Inspire, skin fall downwards, expire. Push in, inspire. The inspire, the body will push your hand upwards. You don't need to move your hand upwards. The body will push. Sure. That's why you can feel the lower border of the liver. Okay, you'll feel it here. Okay.
Okay.
What do you say?
Conclusion.
Liver is unpalpable. Yeah, that's it.
Liver is palpable.
I know.
Unpalpable.
Unpalpable. Don't say liver is palpable. Because if liver is palpable, then you need to say the size, the consistency. No, is there nodules?
So
is it
like the
soft?
intestine
Is it hard?
Impalpable.
No, it's a lot of work. But usually, like this is unpalpable. So, but
How about the intestines?
That's why.
intestines, I'll tell you after this. Each and everything for intestine. Okay. So then, if without percussion, okay, without percussion method, same thing, but you start palpating from down. From here you start. Same thing. Skin, inspire, expire, inspire. Okay. Next, go a bit higher. Same thing. Inspire, expire, inspire. Next, go up a bit more. So you
Until you feel
palpate till you reach the liver border. That's without percussion method. Okay?
I got one question.
Yeah.
If we cannot palpate the liver, how we know to stop?
No, because you would stop once you reach your
Reach the
costal arch.
Yeah.
Yeah, because after that you can't
Okay.
go up anymore already. Once you reach the costal arch, that means
confident.
liver size is normal.
Okay.
Okay? So okay with palpation of the liver?
Yes.
Good. Next, gallbladder. Gallbladder, where's the gallbladder?
This one, tricky question.
Where's the gallbladder? Somewhere there. Okay.
Somewhere.
Somewhere here. Okay? So if you're going to take a mid-clavicular line, okay, if here you're going to palpate for the liver, gallbladder would be a bit higher. A bit higher. Okay, so you go medially a bit for the gallbladder. Same thing, gallbladder palpation is the same as liver palpation. Okay, you're up, you fixate, and it's still the same. Okay, the same method, but there are signs for gallbladder, right? Okay, what's the first sign?
Cup.
First sign would be
Cup.
okay. Okay, so we start off from Ortner sign.
Ortner.
Okay, how is Ortner?
Karate chop.
1, 2. Okay, 1, 2. Ortner. Next, Lapimer. How is Lapimer sign?
Actually, I can spell it.
Okay, okay. Ortner is Ortner. Ortner.
This one is parallel.
Yep.
Karate chop.
Parallel.
No, the linear is the parallel.
Sorry. This is perpendicular. Sorry. Okay. Aorta is perpendicular. Latimer is parallel. So like this. Latimer is okay. Latimer, L-E-P-I-M-E-R maybe. so okay. Okay, Latimer. Okay. Next we have Latimer, Aorta, Rashber. How is Rashber?
Perpendicular there.
Put here.
Then
Punch. Put here. You punch. Okay, there is Rashber. Next you have Kerr sign. Kerr sign, you use your thumb and you press. And then you see. Lepas. Okay. Next you have
Murphy.
1 point. Next you have but Murphy, the patient has to stand. Murphy patient has to stand, and how are you supposed to do Murphy is you go, the doctor stands behind the patient, so you put your hand like this. Okay, he stands like this, so you go behind. Okay, this is the costal arch. Okay, so you take a hand here, upwards, and ask the patient to inspire. Inspire, and you press. If it's enlarged, once you press this, you take it differently. Okay, once you inspire and you press, he will stop. Because it's you stop breathing because it's painful. It's very painful. So he just stops like that. So you know it's the gallbladder is enlarged. Okay, that's Murphy sign from behind. Okay, you hook up. That's Murphy. Next is what sign? No, phrenic sign. Phrenic sign is the same. Okay, here, right? See, here. Yes. Hook in between.
Between the legs.
Okay, between the legs. Okay, this is phrenic sign. Okay, so altogether there are how many? 6. Okay. Okay, finished with that. Liver gallbladder done. Next, spleen. Okay, spleen. Okay, for spleen, first we start off with percussion of the palpation of the spleen first. Okay, palpation, no spleen is over this side. It's also under the left costal arch. Okay, so for palpation, for spleen, patient has to sleep
On his right side.
lateral side, sleeping baby position. Okay, so how? He has to sleep like this.
I see.
Okay, so you put your hand like that.
Oh, very fast,
This leg bengkok, but this leg straight, like this. Okay, a sleeping baby position. Okay.
Okay, don't sleep.
Okay.
Can you come here? Okay. Okay. So now you need to percuss first. Percuss the lower border of the spleen would be here. Okay. Percussing the lower border, you start from the umbilicus. So from here you go upwards. Okay.
Can see actually.
Here's the umbilicus. Place your hand here, and you're going upwards. So okay, percuss. Okay, you stop. This is the lower border of the spleen. Okay, next is palpation. How do you palpate? The same thing as liver palpation. So your hand is like this, flat on the abdomen. Fix it here. Same thing. Skin fold. Sorry, inspire. Skin fold downwards. Expire. Skin fold in. Inspire again.
Okay.
You feel it. Same thing. Okay. You cannot palpate. So same thing. Skin fold downwards. Sorry. Skin fold downwards.
In.
Then in. Then up. So inspire. Expire. Inspire. But fix it.
Okay.
Okay. Flat, the abdomen. Okay. Next, percussion of the spleen. Percussion of the spleen. we take usually the mid-axillary line. Okay, anterior axillary, mid-axillary, posterior axillary line. So mid-axillary line here. Okay, so for mid-axillary line, okay, we start here, right? Here your ribs are oblique, so follow the ICS. Follow the ICS. So your hands would be like this, not like this. This is wrong. See, like this is wrong, because
Follow the
if you
rib
do it like this, you will be
direction.
on the rib. So you follow the rib
Direction.
direction. So the ribs are oblique here. So you percuss first.
Gingerly.
First point. Second point, iliac crest. See, iliac crest is here. Move upwards. Here. Here. It must be 4 to 6 centimeters.
Behind. Kieran better hope not.
Millimeter.
5.
Oh.
Yes.
Okay. So it must be 4 to 6 centimeters.
And this is the spleen.
Spleen.
Or just one size.
No, you have two
Longitudinal.
sizes. This is the
Vertical.
longitudinal. I mean vertical long. Okay, vertical size 4 to 6.
Vertical is 46.
Next, we have to find the horizontal
Yep.
one. Okay. Horizontal one, how do you find? This is the rib kind. See, rib is going like this. So you from the T10, T11. Okay, T10, T11. So this actually, okay, you have to go behind here. Okay, you see.
Sorry, people are blocking you.
Then you come here in front of. Okay, okay, sure. Okay.
The video will be further. You can see me? Okay.
Okay. See, now you just follow the costal arch. The arch is like this kind. It's going like this and going up here. So from behind, okay, the rib is here. So, so from here you just percuss frontwards. You are following the costal arch in front. Okay, follow. Okay, percuss. Here. Okay, it's here. Next, from here. Okay, you're percussing from here, from the umbilicus towards here. Okay, the same way just now how we did before palpation. Okay, so put your hands there and you percuss. Here. So from here to here, you have to measure. It must be 6 to 8 centimeters.
Judgment Day.
6 to 8 centimeters. This is normal. Yeah. 7.5. So it must be 6 to 8 centimeters.
Yes.
Okay. I think this is easy. Only this
Yeah.
part is a bit difficult. But you have no choice. Just put your hand here and just percuss. But the thing is, just follow the costal arch. It goes here. So from behind that, just percuss like this, coming until you hear changes of sound. Then here is the same thing. From here, just go upwards until the costal arch. Then you stop because until here there will be changes of sound. So you stop here. So from here to here, you just have to measure.
All this you must be sitting in the chair.
Yeah, well, here it's a bit difficult, but on the chair it's easier because he'll be more
Closer to
towards here.
you.
Yeah, he'll be more closer, so it's easier for you to
Do it.
Okay.
Okay.
But you still need to practice on.
And
Yeah,
then
you all need to
if
practice.
they say if it's enlarged, what's the pathology? They'll ask you like
Splenomegaly can
be
lot.
anything. Yeah, that's why.
Can be malaria. Can cause splenomegaly.
Okay.
There can be what is some disorders in the blood
Blood.
hematopoiesis system also can cause splenomegaly. Worm infection in any worms, hookworm or
Oh,
pinworm.
can cause splenomegaly.
Yeah, splenomegaly. Yep.
Oh.
Any parasites. Parasitology, remember you learn in first year? Dracunculosis.
Yeah.
All this.
The latum, saginata,
Yeah, like
sodium.
Saginata and solium not much.
Not
That
much.
doesn't. It's because that only is in the muscles. It
Yeah.
doesn't go to spleen. But this malaria, this
Oh, they move around
dracunculus,
through the-
onchocercosis,
They follow the blood,
which goes by the blood. All
Yeah.
this causes dilatum, deflabbibotulum.
Yeah, the one coming from the.
All, so all this would cause splenomegaly, no?
Yep.
So
Maybe this.
Kieran, you're caught on camera by the way.
Okay.
You want to
HIV,
continue speaking?
HIV.
HIV is okay.
Yes, HIV causes
Oh, because virus.
hepatosplenomegaly. Yeah, any viral infection, all it cause hepatosplenomegaly. Drug, autoimmune drug. Alcoholic cirrhosis also which lead to splenomegaly. Yeah. If the liver is enlarged once, the spleen
Spleen.
eventually will be enlarged too. It's
Of-
hepatosplenomegaly.
Like best friend.
Because
Okay.
because they are same region there kan.
Okay.
Okay, that's for spleen.
Now urinary organ.
Next, urinary organs. Next, for urinary organs, here. No.
Oh,
Stand.
We have to show the Pasternatsky sign. Okay, Pasternatsky sign. Okay. Pasternatsky sign is done in the lumbar region. Okay. Here. Okay, here and here. So how do you do Pasternatsky sign? Is this? Put your hand like this and punch.
Like the Rashburn.
Yeah, like Rashburn, yes. Punch and ask the patient if he feels pain.
Mm.
Okay, he should not feel pain actually. So here one, here one. Okay. In Malaysia, it's not called Pasternatsky sign.
What is it?
It's called kidney punch.
Better.
So if they tell you kidney punch, you're thinking what the hell is kidney punch?
Punch.
It's actually Pasternatsky sign. Okay, so it's called kidney punch.
Mm.
Okay. That is.
Patients have to
Yeah, patient's hand can be right. Just stand and just punch. So if there's some stones in the kidney, pyelonephritis, glomerulonephritis, all the itis of the kidney, when you peel,
Inflammation.
they would feel pain. Yeah. But not only kidney problems, remember, can be also what? Muscle. You
Can
silap
never
tidur, you
Oh,
silap
yeah,
tidur, then
yeah,
your
true.
eye cramp.
Stretch.
Then you go and you do kidney punch, you will feel pain.
Painful,
Then
yeah.
don't go and diagnose, oh, he's having some kidney pathology. It happens, okay? So it can be anything.
Yeah.
Okay, so okay with this kidney punch?
Yeah.
If this is easy, okay.
Painful point.
Palpation of the kidney, palpation of this kidney, listen. Palpation of the kidney, usually she will not ask, but she taught us in class. Okay? It's painful. It will be painful, but I'm not going to, because it's painful. I'll just show you on him how to, but I'm not going to tekan exactly. Okay? See, yeah? See. This is your lumbar region. Betul?
Yeah.
Okay, this is the cartilage. Here. Remember, just now. Okay.
Okay.
So, for kidney palpation, remember just now we used the inter joint between mid clavicle and umbilicus for ascending colon. So, if the ascending colon is here, where should you palpate for your kidney?
All sides.
A bit medially, a bit, not too much, but a bit medially. So, somewhere here. Okay, here's your kidney. Okay, it's here. So, put your hand. Same thing. Okay, put your hand there. Put your hand. Okay, here. Okay, same thing. Inspire, expire, inspire, expire.
So you just press.
So it's
One extra step.
one extra step.
So
So
you just
see,
press until you feel something.
see, look at my hand. Okay, inspire, expire, inspire, expire.
Oh,
Inspire.
See, again,
It's a pupil moving.
inspire, expire, inspire, expire.
Oh, goes down.
Yeah, the second inspire you tahan, you don't go in. Just wait. When he expires, then you go in.
Inspire.
It's painful because you go deeper and deeper. You go deep until you feel the kidney actually.
Then the conclusion for that impalpable.
Usually you can't palpate, can't feel it. But always remember, left kidney is higher or lower than the right kidney.
Lower.
Why
And
lower?
higher.
Why higher?
Wait, let me think.
Yeah, this side lower now.
Why ah?
Got liver.
Ah.
I know, yeah. Lang tag na adjusting niya.
Okay, this is always lower and this is always higher. So if in X-rays you see, don't think it's ptosis of the kidney. Okay.
They won't ask you to do on the left side, right?
Hmm?
They won't ask you to do on
Left side.
the left side.
But this one usually they will not ask you in exam also because it's difficult to do. But who knows? Sometimes they are.
Yeah, they come. They
Ah yeah, forgot one thing. Pancreas.
I was going to ask later.
Okay, pancreas. If suddenly she asks you pancreas, okay,
Oh yeah,
Okay.
you told that last time.
same thing. Bekas. Here. Okay. Pancreas would be 2 centimeters above the greater curvature. So your pancreas would be somewhere here. So just put your hand there. Okay. Inspire. Expire. Here.
For some reason, liver.
No,
and
no.
over there.
Liver and spleen, skin fold downwards.
Oh,
Then
okay, okay.
Complex.
other than that, everything else skin
Inward.
fold upwards. Okay. So you
Okay.
go up and just feel. That's for your pancreas lah. If it's enlarged, you enlarge till here, so you can feel actually
Pancreas.
the tail of the pancreas.
Ah.
So okay,
Okay.
that's for pancreas. Remember, pancreas is above the greater curvature.
Impalpable.
Impalpable, yes. All impalpable. Pancreas, liver, spleen. Okay. Next, urinary bladder. They would not ask you, but I'm just teaching you because you need to know this. I mean, in your later future practice, you should know how to palpate. So, urinary bladder is here. It's here. Okay. So, what are you supposed to do is actually, I'll just show you on this. Okay. No, he has a strip. Okay. So, from the
Pay for that.
from from the umbilical, okay, you percuss downwards. So you percuss. Okay, percuss here. Okay, it's here. Okay. So once you get the upper border of the urinary bladder, okay, put same thing, two hands, huh? Two hands. Put your hand there.
Like the ilium.
Yeah, exactly the same. Put there and palpate. Skin fold upwards.
Then down.
Downwards. Same method.
Okay.
Okay, because it only be enlarged till here. Maybe if the bladder is full, if there's full of urine,
Urine.
it will be enlarged. Or no, it will be low. It will be low.
Okay.
Okay, so that is for urinary bladder. Percuss from the umbilicus, go downwards. Put your hand there and palpate.
Okay.
You can feel. Even by palpation, you can only feel the bladder if it's full. If it's full, when you press, it will be kenyal. Kenyal is what do you say in English? Kenyal.
Plastic. No.
Yeah, something like rubbery like that. Okay, you just have to press and then you can feel it. When you press and the patient will like jerk because you're pressing. He might just pee there. Okay,
Yeah, that's actually.
so
It's
that
sensitive.
is for urinary bladder.
Okay.
Okay. Rectum all they won't ask you to do, but you should know the technique. Okay, technique for rectum. Rectal examination is digital examination. Okay,
Oh, that's
digital examination. Okay, so how patient has to lie laterally. Okay, he lies laterally. It's exactly like that sleeping baby position, but now it's over that side.
oh, the ass
Okay.
facing.
The ass has to face you. Okay, so when the patient sleeps there, right? So you use your
Okay.
It's up to you. Like if your hands are too small, you can use 2 fingers, or
Up to you.
if your fingers are big, you can use 1. So it's up to you. So what do you do? Okay. So the patient is here, kan? And then you are here. Okay. This is the anus. Okay, hole. Okay. So you, of course, you have to put what? I mean,
Lubricant.
gloves, yes, lubricant.
Correct.
You must wear the gel, anesthetic gel.
Anesthetic gel.
The anesthetic
So
gel
no
lah.
pain.
Yeah, so that he doesn't feel pain. So you put in. Okay, for guys usually we check what? For what we do a VR? Prostate. We check for prostate. So it depends. If you want to use your left hand, so you put it like this. Okay, you insert. Here's the hole, right? Slowly insert. Slowly
Oh, not
insert.
straight away.
Hey, no, you straight away insert. What? Okay, slowly insert. Okay, because the muscles are there, his sphincters are there.
So painful.
No, if you
So
straight away
okay.
insert, it will contract.
Fingers.
If it contracts,
Break your finger.
your hand will be gone.
That's strong.
It's very strong.
Wow.
Yeah, don't play.
Oh, wanna try?
Oh, that's
Sphincters are strong. The two muscles that
Cannot go.
are strong is the sphincter muscle, and for girls, yeah,
And the
your vagina muscle is there.
woman.
That's very strong.
Kieran.
That constricts.
Woman, I understand.
Okay,
What happened?
so
Your baby
what happened? That's it. If anything's inside there, if it constricts,
Die.
die.
You're gone.
I mean, like,
The
I mean,
Patient die or?
No, you.
no.
the
I mean,
patient
I'm
can-
talking about for girls.
No, I didn't
For nothing like. I mean,
Nothing.
your hand will be okay. Like you can just pull up,
Oh.
but usually we don't do it fast. Just slowly, okay? Because you put it like this.
I don't think I want to do that.
And then slowly. Once you go in, feel here. Here's the wall cut. You go in, feel. Just palpate in front, not behind. In front. You feel if there's any enlargement. That's it. Feel and then slowly remove your hand. But for old people, we do this just to check for prostate or if there's occult bleeding. If there's bleeding inside,
the-
hemorrhoids. Sometimes your hemorrhoids are not visible, it's inside. So once you put your hand in and take out your gloves, will be filled with blood. Okay, so you check for that.
Okay.
Okay, that's for that. Then what else?